Imagine walking into a doctor appointment and hearing the words, "You have type 2 diabetes." The immediate thought is that life has changed forever. But what if the diagnosis was not permanent? What if reversing the condition was possible by addressing its root cause instead of only managing symptoms? That is the central promise of the Diabetes Code by Dr. Jason Fung. This book matters because it challenges the conventional view of diabetes as a life sentence and instead explains how lifestyle choices, particularly diet and fasting, can bring back control. Why conventional treatments fail. Standard care often focuses on lowering blood sugar through medications. Drugs like insulin injections or pills may reduce glucose levels, but they do not address the underlying cause. High blood sugar is a symptom of deeper dysfunction, insulin resistance. When the root is ignored, the disease continues to worsen despite treatment. Consider someone who adds more buckets to collect leaking water instead of fixing the pipe. Medications are those buckets. They manage the overflow but never repair the leak. A study published in The Lancet demonstrated that people on intensive drug therapy often saw weight gain, higher insulin use, and progression of complications. Proving symptom management is not enough. The real culprit, insulin resistance. At the heart of the condition lies insulin resistance. Insulin is the hormone that allows glucose to move into cells for energy. When cells stop responding properly, the body produces more insulin to compensate. Over time, this cycle leads to higher insulin levels and worsening resistance. Imagine shouting at someone across a noisy room. At first, they hear you, but with repeated shouting, they begin tuning you out. The voice is insulin, the person is the cell, and resistance builds. Research from Harvard Medical School confirms that elevated insulin precedes type 2 diabetes by years, highlighting that the problem begins long before diagnosis. The role of diet. The modern diet, loaded with refined carbohydrates and constant snacking, fuels the cycle of insulin resistance. Every time carbohydrates are eaten, insulin rises. Frequent meals prevent insulin from ever dropping, locking the body in fat storage mode. Picture someone eating cereal at breakfast, a muffin at mid-morning, a sandwich at lunch, a granola bar in the afternoon, and pasta at dinner. Their body is constantly flooded with insulin. Over decades, resistance grows stronger, and the pancreas becomes exhausted. Studies from the University of South Carolina found that people who reduced processed carbohydrates and ate fewer meals per day improved insulin sensitivity and lowered fasting glucose significantly. Why calorie restriction alone does not work. Conventional advice often suggests eating less but more frequently. This may reduce calories, but it does not solve the hormonal imbalance. The body adapts by slowing metabolism, creating fatigue and hunger, making long-term weight loss nearly impossible. Imagine lowering the thermostat to save energy in winter while leaving the windows wide open. The strategy misses the real problem. Research published in Obesity Reviews showed that repeated calorie restriction without addressing meal timing leads to plateaus and weight regain. The power of intermittent fasting. The breakthrough comes with intermittent fasting. By deliberately creating windows of not eating, insulin levels fall, giving cells time to reset sensitivity. The body switches from burning glucose to burning fat for fuel. Think of a refrigerator filled with fresh food and a freezer packed with reserves. As long as the refrigerator is stocked, the freezer remains untouched. Fasting empties the refrigerator, so the body finally opens the freezer and uses fat stores. Clinical trials at the University of Toronto showed that participants practicing intermittent fasting had significant reductions in fasting glucose, insulin levels, and body weight compared to those on calorie restriction. Different fasting strategies. Not all fasting patterns look the same. Some practice daily time-restricted eating, such as 16 hours fasting and 8 hours eating. Others use alternate day fasting or longer fasts under medical supervision. Each method reduces insulin and allows metabolic healing. For example, skipping breakfast and eating within an 8-hour window gives the body 16 hours without food. Over weeks, energy stabilizes, hunger reduces, and glucose readings improve. Low carbohydrate and whole foods eating. Fasting works best when paired with nutrient-dense eating. Low carbohydrate foods such as vegetables, proteins, healthy fats, and unprocessed meals keep insulin responses moderate. Imagine replacing breakfast cereal with eggs and avocado, or pasta with grilled fish and roasted vegetables. These choices prevent the insulin spikes that drive resistance. The New England Journal of Medicine reported that low-carbohydrate diets improved glucose control more effectively than low-fat diets, even without calorie counting. Reversing type 2 diabetes. The central message is clear. Type 2 diabetes is not inevitably progressive, can be reversed by reducing insulin resistance through fasting and dietary changes. Patients who adopt this approach often lower medications, lose weight, and restore normal glucose levels. Consider an individual who has lived with the condition for 10 years. After 6 months of intermittent fasting and whole food eating, their glucose normalizes, medications are reduced, and their doctor calls the change remission. Debunking myths. Several myths hold people back. One myth is that frequent eating keeps metabolism high, but science shows constant eating prevents fat burning. Another myth is that fasting is dangerous, but research proves it is safe for most healthy adults when done properly. A 2019 study in Cell Metabolism showed that fasting improved cholesterol, blood pressure, and inflammatory markers, proving its wide benefits beyond glucose. Long-term sustainability. The goal is not a quick fix, but a lifelong shift. Once insulin resistance improves, the body can tolerate occasional flexibility. However, returning fully to processed foods and constant snacking will reignite the cycle. Picture maintaining a clean house. It requires regular care, not just one deep cleaning. The same is true for metabolic health. Closing takeaway. The lesson is powerful. Type 2 diabetes is not just about blood sugar. It is about insulin, hormones, and lifestyle patterns. The solution is not found in endless medications, but in reclaiming control over eating habits and timing. Here is your challenge. This week, try one change. Skip late-night snacks. Experiment with a 12-hour fasting window, or swap refined carbs for whole foods. Small steps break the cycle of resistance. The power to reverse diabetes lies in choices made every single day. Your journey to better health starts here. Subscribe now for fitness tips and natural diabetes reversal guides. Take care, stay healthy, and see you in the next video.